back, and joining us now is Dr. Marilyn Crabtree, a family physician with the St. Lawrence Medical Clinic of Ingleside and Morrisburg. Dr. Crabtree, you have been a big advocate for the BounceBack program in your community, and I'm so glad that you can be here with us today to share your insights on this wonderful new program.
Well, thanks for inviting me.
Anytime. So would you be able to tell us a little bit more about yourself?
So I've been a family practitioner in this area for close to 30 years, since 1992. I do full scope family practice. I do birth, I do deliveries, I do palliative care, I do chronic disease. I've developed some techniques in mental health and addiction because it's such a common need. So it's kind of how I came to enjoy this program, and I guess why I'm here.
Okay. It sounds like you have a great deal of experience in this field. Thank you for sharing. And I know that I understand that you might see a lot of patients on a daily basis. What would you say are some of the most common mental health challenges that you see in your patients? So,
I mean, the most common ones would be just day-to-day stress, how they're coping with stresses in their personal lives, stresses in their work life. Certainly see a lot of formal diagnoses, generalized anxiety, depression, and other kinds of disorders. And it's a question of how to help these people, because some people just want to talk about it. Some people want to have some counseling. They want to have someone to talk to. And other people want medication. And most people need some sort of combination approach. Having this program is really helpful because up until we had it, I really had nowhere to send people. And I was either having to look after that stuff myself without having the formal training that many of these people have that are working with your program, or I was putting my patients on these long wait lists. They might wait 4 months, 6 months to actually get seen.
I must ask, what do you like about the BounceBack program, and how do you see that benefiting your clients?
So, for example, if I have someone who's just really struggling with how to interact with their family, and they're really just not quite sure how to make that connection without creating a bunch of drama. Some of the program modules are about how to de-stress from just drama. So that's a simple way to not end up depressed, because you're not letting the drama affect you.
Yeah, you're not letting it get to that point. You're becoming aware of it, and you're stopping it as fast as you can.
Yeah, exactly.
Okay. And so what is the referral process like as you being a doctor? Do you typically refer your patients or on an individual basis, or do they ask you about the program?
So I don't think the program's very well known at this point. I'm sure it will become better known, and hopefully this will help.
Yes.
Because I think it's a program that should be advocated for from both a clinician perspective, so your family doctor, your mental health professional, your nurse practitioner, but I think it's also a program that patients should be aware of, and they can share with their friends and family, so that, if they know someone that's struggling, you should ask about this. I typically do a full history physical diagnosis, because I really want to know what I'm trying to help somebody with before I actually make a recommendation for treatment. And then once I've kind of got an idea in my mind of what I think is going on, I'll have a conversation, because it's not about me deciding what they need, it's about me working with my patient to figure out what they need and what's their goals, and then helping them pick a program or a strategy that might be useful for them and work within their parameters. Because for some people, going to a formal counseling program is what they want, but they may not have the time to be able to take off from work, or they don't have the transportation if they live in my area to get to town to a counseling program. So this gives them the opportunity to get some mental health support right from their home.
I really like that you do, you get to know your patients very well and do a full diagnosis to make sure you're not referring them into the program if they're not a good fit. So I really enjoy that you do that, because you don't want someone to go into a program and then get rejected from it because they scored too high on the depression test to get into the program, and then getting rejected, and maybe not wanting to go to any other service because they can't get into that one. They think they can't be helped. So I like that you do that full diagnosis to make sure that they're the right fit.
Yeah, it's very important.
And so I know that there's still a lot of stigma around mental health, so I have to ask, what advice would you give to your patients who are nervous about speaking to their family doctor or anyone about mental health?
Well, mental health for family doctors and nurse practitioners and pretty much anyone in the healthcare system is pretty much bread and butter. I probably see more mental health patients every day than I do cough and cold, which seems remarkable when people think about a family practice office. But the honest truth is, if you're sitting in the waiting room and you're looking at someone who's coughing their head off, you know they have a cold.
Yeah.
If you see someone with a cast on their leg, you know they have a broken leg. But everybody else in the waiting room, you don't know what they have. They could have mental health, and probably half of them do. So it's important for patients to recognize, I don't see depression or anxiety or other mental health conditions as any different than diabetes or epilepsy or something else.
Exactly.
And diabetes, for example, requires you to see a dietitian, and I would want you to get some education about the disease, and I would want you to learn strategies around how do I go out for dinner with and manage my diet. And if I didn't offer that and all I did was hand you insulin, I wouldn't be doing my job. So mental health is the same. I want to figure out what it is, and maybe your treatment requires medication, but maybe it doesn't. And I want to work with you to figure out what you can do so that you can minimize the need for intervention and medication and long-term treatment. And if I can help you with that, then I'm doing my job. And
I think you said it all. That was, I could never have worded that any better. It's the same thing as any other health issue. It's just sometimes it's not as noticeable to see depression in someone, which is why it's so important to talk about it with your doctor, your nurse practitioner, anyone, even your family and friends, to let them know that you're struggling and that you need to get the support and services that you need.
For sure. And I'd encourage people who might be watching this show, if this program isn't right for you, but you know someone for whom it is right, please get them to talk to their doctor or their nurse practitioner, or self-refer, because that's always an option as well.
Thank you so much for saying that. And also thank you so much for being here on the show with us today and sharing your insights on this program.